Hello everyone, Dr. David Kulla here with Synergy Wellness. So I belong to a couple of groups on Facebook, and one is for spinal stenosis sufferers, and I just see all sorts of comments there. So I'm gonna make my own video on this subject of spinal canal stenosis. Everybody with spinal canal stenosis is really struggling and searching for answers, and unfortunately surgery is just not a good answer, and the outcomes are awful. And whatever they say they are on the internet, they're worse, okay? They're bad, 5 years plus post-surgery. So then you're looking at injections, and a lot of people are commenting in these groups, like, how is physical therapy helpful? Is it gabapentin helpful? Yeah, I mean, these things are helpful to reduce pain. But I want to specifically touch on physical therapy. And physical therapy, is it helpful for spinal stenosis? Yeah, it can be. But it's not the answer. If you're expecting physical therapy to get rid of all your symptoms and heal you, it's not gonna happen, I'm sorry. Now, physical therapy is helpful for the condition of spinal stenosis. But remember, physical therapy is the study of muscles, tendons, and ligaments, not disc, nerve, spinal cord. Okay, so there's a clear distinction there. So the physical therapy is for after you get out of pain to strengthen and stabilize your core and your spine so you don't re-injure it, okay? Now, for those of you suffering from spinal stenosis that are in pain and suffering right now, numbness into your legs, or it could be stenosis in the neck. I have spinal canal stenosis. I implore you to try cold laser therapy, low-level laser therapy. Make sure you get a doc that knows how to use it and knows what they're doing and has years of experience using lasers. That being said, that with Cox flexion distraction technique. Both of these are researched. Laser is heavily researched. Cox technique is heavily researched. Go to Cox Technique, it's spelled TECHNIC.com, and you will find certified doctors, and there's some certified that are no longer on that website, so after a year they get taken off the website, but they still have the certification. So you want to make sure they've been certified at some point and they know how to use cold laser therapy. This is a game changer. This worked for me. I have spinal stenosis at every level in my cervical spine, and yes, I'm a chiropractor, and yes, I get chiropractic care. I get Cox technique done with cold laser. This was the game changer for me. Cox technique got me about 70% there. The other 30% still having headaches and things like that. And I've had multiple traumas, okay? Been through windshields, car accidents, all sorts of head trauma growing up and in my younger adult life. So I can tell you without a doubt, cold laser therapy when done correctly and Cox technique when done correctly, okay? So I hope that helps all of you that are suffering from spinal stenosis. If you have any other questions, comment below, and thanks for tuning in. See you soon. Thank you guys so much. If you got anything from this video, or even if you just like this view of the Empire State Building and the Chrysler Building, give me a like and don't forget to subscribe. Appreciate you guys.